This video is over the cardiovascular system for medical terminology. This is chapter 11 in your textbooks. There's a great introduction, and then we start getting into blood vessels and the circulation of blood. There are different types of blood vessels, and they go into these right away for us. Arteries, veins, and capillaries. Again, really hone in on the bold terms here when you're reading. Arteries go away. In most cases, that's how we remember arteries away. Okay, they both start with an A. As we get smaller and smaller in the arteries, they branch off and branch off and branch off and branch off. And as we get to those smallest arteries, they are arterioles. It is the smallest of the artery. And the same thing happens with veins. As the veins branch and branch and branch, the smallest of the veins are venules. Okay, so O-L-E and U-L-E there. The pictures on the next page are really good to show you how thick and strong those arteries are. If they pump the blood away from the heart, that's the very oxygen-rich blood that needs to go to all the muscles and organs in the body. It's very strong and thick-walled. Okay, the pulse that needs to happen to get that blood circulating is very strong. And the veins, as you can see, are thinner. Okay, they're bringing, and we use blue for that, they're bringing the oxygen poor blood or the carbon dioxide blood back to the heart and through the lungs so that we can, breathe that carbon dioxide out. So there's a really good picture there, the pink side versus the blue side there at the bottom of the next page. If you look at circulation of the blood, the oxygen poor blood, it says in that third paragraph there, enters the right side of the heart. Okay, pulmonary circulation is something you need to understand there, and you can read about that. And the picture on page 402 is talking about pulmonary circulation, what's happening there at the lung and more central body level. On page 403, the picture is showing systemic circulation, and really systemic, obviously is going out, to the body systems or the rest of the body. The next page really shows the anatomy of the heart. You can label that as you read through it if you wish. We don't spend a lot of time on knowing all the different parts of the heart. The heartbeat and the heart sounds, we really do need to make sure that we master whatever. We need to understand what diastole and systole mean. Diastole or diastole, people say it different ways, and it's okay either way. Is the relaxation phase, and systole is the contraction phase of the heart. They talk about a murmur there on that page, so you can read about that. Over on page 408, they talk about the pacemaker of our heart. And this isn't an actual machine that's been put in. We are born with a natural pacemaker, and that's what they're talking about, that keeps our heart in rhythm all the time. Okay? When they, in the middle of that page in your bold terms here, when you read left bundle branch and right bundle branch, LBBB and RBBB is what we see in medical terms and medical reports, a left bundle branch block or a right bundle branch block. So you can see those. Sometimes I kind of have the LBBB written in the margin there and the RBBB written in the margin there, because that's what you sometimes see. And then they explain the PQRST wave. There's a picture of that up above on page 409. And then they talk about, at the bottom of page 409, blood pressure. Okay, so on the page before we talked about diastole and systole, right? Okay, the contraction phase and the relaxation phase. So when we talk about blood pressure, it's all kind of explained to us there at the bottom of page 409. First of all, and if you want to say this with me, a sphygmomanometer. Lots of times people, your mouth just does crazy things sometimes when you're talking medical terminology. A sphygmomanometer is the blood pressure cuff, the machine that we use to take our blood pressure. Okay, a sphygmomanometer. And if you see at the bottom of that page 409, I have written in systolic on top with a slash, like as a fraction, over diastolic. Okay, systolic over diastolic, or 120 over 80 is a normal blood pressure. Okay. If you turn the page, we get to vocabulary. You can see a plural at atrium, a plural at septum, and a plural at vena cava. And then we get to our blue boxes. The combining forms here, nothing really having, nothing too crazy with combining forms. Make sure you go through them. I think this is the first time that we get cyano. If you look at that combining form, cyano, C-Y-A-N/O, cyano means blue. Okay, that seems a little odd. If you look at cyanosis and that term, cyanosis, underneath it, it says the bluish discoloration of the skin indicates diminished oxygen content of the blood. Cyanosis would be that abnormal condition or that condition of bluing of the skin, and what it really comes from is low oxygen. And I think the most common thing that I can think of to kind of relate this to is the little kids in the swimming pool where they're shaking and they're cold and their lips turn blue. Okay, that's low oxygen. Okay, that's the kind of thing that we're talking about, or when we get cold. Phlebo means vein. Here's the RRH again, rhythmo for rhythmia. RRH, make sure you spell those correctly. And then that's it. There's no prefixes or suffixes, just combining forms here. Otherwise, it's all ones that we've used before. So how does a pacemaker work? There's a watch box at the bottom of the next page that's really good for you to focus on. The next page has a really good watch box too. And again, these are all just to make you smart and make you look smart and make you sound smart. Palpitation versus palpation. Okay, palpitation looks like what this guy could be feeling right now on his chest on the screen. Palpitation or palpation. Palpitation is listed here for us, and it's listed up above. It says it's an uncomfortable sensation in the chest from a missed heartbeat. A palpitation is a little skip or issue with your heartbeat, and sometimes they're completely normal. Okay, if you have palpation, okay, when we talk about palpation, we talk about the doctor palpating, okay, feeling something on your body. That's palpating, touching and feeling. Okay, so know the difference between those. We get into conditions then that we're talking about here. Tetralogy of Fallot, congestive heart failure, or CHF, which is a good abbreviation for you to know. Coronary artery disease, or CAD, is another great abbreviation for you to know and be able to recognize. There's some terms here that kind of start on page 422 and go along, and I'm going to hit them in the study section, that pink or purple page 426. A beta blocker, you need to make sure you understand and know what that is. Auscultation, I guess is right above beta blocker, excuse me. A bruit, cardiac tamponade, claudication, palpitation, thrills, and vegetations. I would kind of mark those, and I'll say those again. Beta blocker, or excuse me, auscultation, beta blocker, bruit, cardiac tamponade, claudication, palpitations, thrills, and vegetations. I would mark all those and make sure you understand those terms. Those terms are going to come up for you. Lipid tests, over on the laboratory test, lipid tests are really big. Right above the lipid tests, the cardiac biomarkers, so the troponins. Troponin is a substance, it's a muscle protein that comes from the heart. It's only released, so it only is circulating after there's been injury to that heart, meaning a heart attack. So if you feel like you're having a heart attack and you're having chest pain and you go to the doctor, the very first tests they run are troponin levels. They want to know if they're increased, it means you have had some kind of injury to that muscle in the heart, meaning you've had some kind of a cardiac arrest or heart attack. Okay? The next tests are all here. Some of them, most of them we've maybe seen a little bit before. Cardiac catheterization is one to make sure you understand. An ECG, a CABG, coronary artery bypass graft is listed on page 432. That's a very good one to make sure you understand. And these pictures are really good down at the bottom of 432 and 433 as well. Make sure you understand those with putting in stents and things like that. And then that's the end of the chapter for cardiovascular.